Hello, everyone, and welcome back to Medicine Uncorked. I'm Mike Lipock, nurse practitioner and owner of Wiregrass Direct Primary Care. This week, we're going to be talking dollars and cents, and I'm going to make it ridiculously simple. This week, we focus on all the fixed, variable, and hidden costs that come with running a medical office, from rent and staff salaries to gloves and lobby snacks, and walks through calculating the monthly and hourly cost of staying open. To start this week's episode off right, we're going to be opening a bottle of 19 Crimes. It's a red blend from Southeast Australia. I've never had it before, so I'm really excited about opening it up and giving it a try. So what we're going to be talking about this week is starting a business. And this isn't going to be a clinic. This is going to be a hot dog stand on the corner. So first thing you want to do is you want to find a good cart. A steam table, something to set up so you can, have your hot dogs warm and your buns warm and everything ready. And let's set aside about $4,000 for that. Then we're going to have, permits, licensing, and signage, supplies. You're going to need your food handler's license, and there's all kinds of stuff that you're going to need before you even get started. And let's say that cost you somewhere around $1,300 for all that. And then you're going to need inventory. So you're going to have an initial run to the store. You're going to buy your hot dogs, your hot dog buns, and you're probably out $500 for that. So all in all, you're going to be out about $5,800 before you sell a single hot dog. Your monthly cost looks like this. You're going to have hot dogs, buns, and condiments that run you $1,000 a month. Fuel that's around $200 a month. Paper goods for around $100 a month. And then insurance, card fees for accepting credit cards, and maintenance of the food cart. So somewhere probably close to around $1,650 or $1,650 in monthly overhead. So if you sell, now let's talk about revenue. If you sell each hot dog, I'm going to have a taste here of the 19 Crimes. You could definitely tell there's hints of chocolate in that. It's pretty sweet, soft, fruity. Okay. Not bad. So let's say you sell each hot dog for $5 and it costs you $2.50. You make $2.50 per dog. All right, this is very simple math. That means you need to sell 660 dogs a month or 33 a day just to break even. So if you look at all the costs that you're going to be spending on a monthly cost, that $1,650, you're going to have to sell 33 hot dogs every day just to make that cost. And we're not even putting anything towards the startup cost. Now imagine you're going to hire someone. Maybe you're just going to have them work like the lunch rush, but you're going to have them 6 hours a day at $15 an hour. For a month, that's about $1,800 a month. So this is where you would calculate your burn rate. Your burn rate right now would be $3,450. That's 1,380 hot dogs a month just to cover the help. Not growth, not profit, just bottom line survival. Okay, so let's talk options. What if you took on a partner? You said, this is a lot. We may need to 50-50. So you're gonna split the work, you're gonna split the profits, you're gonna split everything. Great, as long as you both do 50% of the work. But what if one doesn't? What if someone's just doing half the effort and you're putting forth more effort? You're gonna be giving away over half of your income for half of the effort. Now, you kind of understand costs, you kind of understand the sales perspective of needing to sell hot dogs to make that bottom line And that's kind of the eat what you kill model. So we're going to bring that back to medicine. Each patient visit generates a relative value unit. But like a hot dog, you don't keep the whole profit. RVUs are divided three ways. You have a work RVU, 50% goes to the provider. 50% of the RVU goes to the provider as a work RVU. Then you have malpractice RVU or MRVU. That's 5% of that RVU total goes towards malpractice insurance. And then you have the practice RVU or PRVU, which is 45% for the clinic infrastructure, additional medical assistance and all the cost of the practice. So it really is exactly like taking on a partner every time you hire a provider. If you're starting a business and you're the one that's taking on all the risk and you're the one doing it all, this is going to be really easy math for you, because you just need to calculate all the costs, and you know that everything is coming to you, all of the work RVU, all the malpractice, and all of the practice RVU. So, but just remember, if you're going to hire an additional provider now, so even if you do all the work, you're only going to get half the credit, just like the hot dog stand. If you don't know your costs, you're really not in business. You're guessing. You're hoping the math works out. And if the math doesn't math, you're going to burn out and you're going to end up closing shop. And that's not going to be good for anyone. We want to make sure we're able to care for our patients. Opening a clinic is just not about the furniture, the licensure, the medical equipment, the signage, the EHR contracts, the marketing, deposit fees, and inventory. It's about patients and patient care. But we have to understand the operational cost if we're going to survive and be able to help anyone. When we close up, we're not going to help anyone. And that's not going to be good for the economy. It's not going to be good for the community. And all those patients are going to be left in limbo. So these additional startup costs, or these startup costs and operational costs, they can easily be $30,000 to $100,000 upfront, depending on the size and scope of your practice. And once opening, that's when the real costs begin, because you're going to pay to stay open, whether it's one patient or 100 patients. So this is for all the listeners out there, whether you're a student, whether you're a provider, MD, DO, NP, PA. If you're someone who is being paid to work and you're seeing patients and you're billing insurance, you are on the fee-for-service model. If we go back to that first episode, we talked about there's PMPM and fee-for-service. Most NPs are all going to be fee-for-service because of if you'll go back and listen to the first episode, you understand that most of the time we cannot contract with insurance and get PMPM. So we're going to be in the fee-for-service structure. But let's talk about those fixed monthly overhead costs. Because really, if you're a patient, this applies to you, because you really need to understand why you're sitting at the front desk, maybe questioning those copays and what the clinic's making. How is this possible? There's just so much money. Doctors are rich. It's just not happening. At least not in primary care. That's another episode. So fixed overhead cost. Let's talk about a realistic breakdown for most docs. So we're going to be spending about $3,000 a month in rent, maybe $400 for an electronic health record system, and then another couple $100 a month for phones and internet. And then you're going to have malpractice and liability insurance, which is going to run you probably around $600 a month. And then all the subscriptions, licenses, DEA license, state licensures, CUs to keep up with. Let's set aside about $300 a month for that. So your total monthly fixed overhead cost is going to be around $4,500 to $6,000 a month before you ever touch a patient. You're never going to have a patient at the door. You're going to have to pay out $5,000, $6,000 a month before you start even bringing in revenue. Now, the variable costs is something that is not fixed. So, the things we talked about are going to be coming every month. Variable scale with patients. So as you see a patient, the costs go up, like gloves, syringes, alcohol swabs, strep test, urine test, flu test, pap smear kits, biopsy supplies, vaccine inventory, sharps disposals. All those things are kind of variable, but they're tied to your workload. So, you can need to think about that and kind of factor those in based on your volume. Now, I buy from a couple different places, and I was looking at both of my invoices trying to figure out what my monthly cost is, for instance, and I spend probably somewhere around $5,000 a month on variable costs. So that can be, now again, we have about 17 employees, give or take. We have 2 locations. We have 6 nurse practitioner providers, 1 MD, and office manager, administrator, and several, MAs and various front desk receptions. So, and we do everything that is in the primary care scope of practice. So a lot of people, that'll be an episode later on where we talk about scope and kind of what that entails and what it should be, because a lot of people get really confused about what primary care should be. But we'll talk about that later on. So the next segment we're going to talk about is hidden costs. So little things that slowly drain your margins. So like basically things that you want to put in the lobby. So for instance, I have a coffee maker, I have a water machine, it's cold water and hot water. Patients can make a hot chocolate or coffee for themselves or for their kids or whoever's with them. And that has a cost. I mean, you got to think about that cup, that's 10 cents, that Dixie cup or whatever that you're buying is 10 cents, the lid, and the creamers are like 6 cents a piece. You calculate those into, what if a patient uses 6 creamers and 4 sugars and they use a cup, you're putting in 50 cents to that patient or, something like that. So you kind of have to have those figures and really think about it on that scale. If you're going to be successful, you got to have paper for printers, toners, ink, and forms that the patients fill out. You have to have pens, a paper, like pencils, tape. We don't use whiteout, so that's a no-no in the healthcare business. Staff snacks, so if you want to offer snacks, in the back in the lunch room, or if you're going to have things set aside in the morning. Seasonal decorations, so if you want to decorate for Halloween, you want to decorate for Christmas, or Hanukkah, or New Year's, Valentine's Day, 4th of July. I mean, it could add up, and you're gonna have to store, where are you gonna store this stuff? In the attic? If it gets hot, it melts, now you gotta replace it. I mean, there's all kinds of things that you have to think about. All your employment signage, OSHA signage, and then team apparel. Are you gonna buy scrubs from the team, or are you gonna have an allotment? At my office, after about 90 days, the employee is allowed to go to a scrub store and purchase 2 sets of full scrubs with embroidered logos. I like to do that for my team. I like for everyone to look professional, so that's something I'll do for everyone. And then prize repairs, last minute orders. So we run out of something and you have to overnight something. There's going to be, unprepared expenses. Your air conditioner goes out. Most commercial leases, you are responsible for everything in that office, from the air conditioner to lights. We have fluorescent lighting. I just changed a ballast yesterday that went out in one of my fluorescent lights, and those are pretty often. I'll replace 3 or 4 of those a year, and the lights themselves, the tubes. So it can be a strong undertaking to think about all those hidden things. So you want to have some type of emergency fund or fund set aside for that. And I call that that's the death by 1,000 paper cuts segment right there. All those little things, they will cut you to death if you're not careful. And now we talk about the staffing costs. I know I mentioned that a little bit, but hiring someone at $18 an hour, it just isn't $18 an hour. You have to add on additional dollars to that. You have payroll taxes, you have paid time off or unpaid time off, you have onboarding, training that employee, workers' comp. So that really multiplies out to close to $22 to $25 an hour, and that's without having any benefits. So I know that that's something that my employees wish that we had. We have under 50 employees, so we don't really meet that requirement yet. And I don't even know how we would, to be honest. That's why we're having this show, is to talk about the expenses and reimbursements from insurance and how this all breaks down, and how we're supposed to stay afloat in today's world of insurance and healthcare. So you multiply that across staff though, and you have all those extra costs. You're talking $20,000 to $30,000 a month easy in just staffing costs. So depending on how much you grow and what you're looking for. So after you figure up all those costs, now you're going to have this final burn rate. So your monthly expenses are $40,000. Let's say you're open 160 hours, so that's 40 hours a week. That equates out to $250 an hour just to stay open. It means when I get there in the morning, if I go up and unlock that front door and I open it to accept patients, I need to be producing $250 an hour for every hour that we're open. Now, mine is closer to $700 an hour with my staff and my rent. I'm in Wesley Chapel, Florida, where the rent is 7 times what it should be. And it doesn't matter that my rent is 7 times where it's at. I could be paying $1,000 a month and I would get reimbursed the exact same as I do from the insurance companies. So that's something that you really want to think about is, yes, location. You move to a rapidly growing area, but the rent, if it's $45 a square foot, $47 a square foot, that is crazy talk for primary care. There is no way you can stay in business paying that kind of rent. So you need to be closer to the $18 a square foot, per year range, or, we're 27, 28 plus, the triple net. It gets too crazy, and it makes it really difficult. And a lot of people don't understand that. The owners of the commercial buildings, they're greedy. They could care less. Just last year, one of my buildings doubled in rent because they built a new complex a couple less than half a mile away, and they matched that rent. My lease was up, so they doubled my rent basically. And it's made it really difficult. Now it's questioning, is that sustainable? Is this sustainable in primary care? How do we make a sustainable practice so we can care for patients and help the local community? What does that look like? How can we do this? So think about that. If your hourly burn rate is $250 an hour in our examples that we've used so far, and your average visit, so if you're an MD or DO, we talk about this, your reimbursements are close to about $80 a patient probably. I would say 65 to 80. I'm always a little bit, I try to be really conservative with uncalculated revenue, because I don't want to miss forecast and then end up short, and then you're trying to figure out what went wrong. So always be on the little light side of things, where you think your reimbursement's going to be. So that would be 3.5 patients an hour at $80 an hour, or $80 per patient. It would be 3.2 patients exactly to break even at the $250 an hour. So that is just your business, your employees, has nothing to do with you, the owner of the business. So if you want to make more money and you want to take home money and grow, you're going to have to see more patients, or you're going to have to figure out how to increase your revenue. So let's now take that back and think about how nurse practitioners are only paid sometimes 40%, 60% of that $80. We're talking about $40 a patient. So now if it was an NP, we'd be talking about 6.4 patients an hour just to break even without taking home any money. So I know a lot of you are like, oh, is this, are we sure we're going to get into healthcare? Are you sure you want to be primary care? Well, a lot of providers just don't understand what it takes to run a practice, especially new grads. They don't understand what it really takes to run a practice. They expect big salaries without knowing what they're generating in return. Knowing your numbers gives you leverage. It helps you negotiate contracts, it helps you build business and stay open. So you really need to think about that. Like, how big do you want to grow? What's going to be involved in managing and hiring additional employees? You know, if you're looking at your worksheet right now and you're thinking, man, how is this even possible? Welcome to my world. How is it possible? You know, there's just so much fraud out there that's happening, and we just don't, we as a industry are just allowing it to happen. And we really need to take a hold of it, and we need to talk with, you know, let's go to the AMA, the American Medical Association. They're the ones who set the CPT codes and decide on those evaluation management codes what the RVU is worth. You know, so if we go to, you know, one of the websites I like to look at is AFP.org, and it's the American Association of Family Practice, and we look at the RVUs. They have a whole section kind of talking about RVUs and what, you know, how to work through how to know how many RVUs you're bringing in and what that looks like. So we'll use a 99214 follow-up code. For instance, a 99214 is worth 1.92 RVUs, and insurance companies pay per RVU. My office, our RVU right now is averaging about $26.50 per RVU. So the work RVU on that, you know, 26 times the 1.92 would give you, you know, close to $50, right at $51, $52. And that is the amount of income that's going to the provider when they see that 99214 office visit. And we really have to understand that, because, you know, if you're out there and you're thinking, man, I'm going to open my office, this is going to be cool, I can't wait to graduate, or you're in your medical residency and you're going to open, you know, your own office, this is what I've always dreamed of. You know, I'm not here to squash any dreams. We have to make it a reality, though, and think about what these costs are if we're looking at fee-for-service patients. And this is why most of the time you're going to be out there looking for MSOs, you're going to be looking for ACOs and CINs, because you want to join them and you want to find out if they have PMPM, so that they're paying you a monthly payment, and that doesn't require you to see a patient, you know, because that money is just recurring. You know, but what I always like to look at is that bottom line cost, because I need to know, like, based on my staffing, what my hourly burn rate is going to be, so I know how many patients they need to see. And this kind of goes hand in hand. If you look at the number one reason why providers are sued, it's because of failure to follow up or failure to diagnose. Those are the top two reasons. So a lot of times when we don't think of it like a business, we see them as a provider, and we may think, oh, you're good on your medications, I don't need to see you for a year, you know, and then they go out there into the world and, you know, maybe they're seeing specialists, they're going to dermatology, they're going to ENT, they're having allergy tests done, and that's raising your cost utilization up. So we'll have to talk about that in another episode, but insurance bases your expenditures basically is your cost utilization, not your personal thing. It's not what was spent at your clinic, but when a patient is attributed or assigned to you, they will develop a cost of healthcare. How much did they cost for the year? And how much in revenue was the revenue from the premiums that patient paid or the government paid for that patient if they're on like an ACA plan. So you got to think about that, because the insurance companies are going to judge you and your care based on cost utilization. So that'll be another episode. But this week's mission, really, we're going to talk about, you know, complete the hot dog worksheet, calculate the hourly burn rate, audit your fixed and variable expenses, start seeing yourself as a business owner, and how do you build that team that doesn't sink your ship? What is the true ROI of an MA, of the front desk, of your office manager, of every NP, PA, MD, DO that you hire? And how do we keep that practice going? How do we provide the care to each patient that we're looking for? Now, I know this has been a little dry. First week's episode was, I look back at it, I listen to it, and I wonder, where is this going to go? How can I improve this? But when you're talking about healthcare, I'm pretty passionate about the cost and, because I want patients to receive care, but I also want to stay in business. And I am trying to figure out how can we make business profitable without being immoral and unethical and not writing things down that didn't happen. And then how do we build things that did happen? One thing that I'll point out, just real quick, I received like a 3-page complaint from the Better Business Bureau from a patient over a $16 charge. Because the start of 2025, we came out with new codes, and those codes allowed us to bill for patient portal communication. Because patients know they have deductibles, they know they have copays, and they're looking for ways around them. So they're going to sneak in that back door, and they're going to send messages to your providers, and they're going to try to get answers and medication refills without paying a dime. It's going to cost you your bottom line. So that's why they came out with these new codes that, hey, when there's communication between a patient and a provider, and that provider is working, because if you're opening a chart and you're working on a chart, you should be getting paid. And I know everyone out there is like, well, I am getting paid. I'm paid a salary by my provider. That is not how healthcare works. So you need to get out of that MA mindset, that nurse mindset, LPN mindset. If you were in healthcare before and you transitioned into that provider role as a nurse practitioner, physician assistant, medical doctor, doctor of osteopathic medicine, whatever, even for a physical therapist, OT, PT, whatever, if you're not actively performing something and that's equating to a bill on a CMS 1500 sheet that's getting transmitted to insurance to get paid, then you have no value. Yes, you heard me. If you're not billing, what is your value? You tell me. It'd be like the hot dog worker selling hot dogs and sells 0 hot dogs the entire day. If you work, you sell 100 hot dogs a day. If they work, they sell 0. Who has value? Remember, healthcare is a business, whether you like it or not. And it is an eat what you kill model. So you better get on the train or get out of the way, because it's coming. All right. I appreciate you guys tuning into this episode. Until next time, follow me at Medicine Uncorked. Cheers.